Good morning. Before I get started, Amy Upton, where are you? Wave your hand. Right back. There. Oh yeah. So you know the name Upton. Fred Upton is was incredible in moving forward our 21st century cures we're waiting for in the Senate. And so things that happen in the Energy and Commerce, it'd be nice to actually call it the Energy, Commerce, and Health Committee, is what we do. But then it would sound like and we don't like that. But Fred's been amazing in his work to work at more treatments. I want to thank you for being part of this. Debbie's my work in getting members of Congress aware that a lot of cancer we can prevent. When we think of it wasn't so long ago, people can remember, I'm sure, that you didn't even say the cancer word. It frightened people. You didn't talk about if someone in the neighborhood had it, they just kind of went away. Now, football teams wear pink. We have massive races for the cure, where people are out there declaring this, whether I know in Pittsburgh we do it for prostate cancer and other cancers as well. Proudly saying this is something we're taking head on, because you can't fight a disease if you're not willing to acknowledge it's there. It's that old saying, if you can't define it, you can't defeat it. And prevention's a big part. I want to mention one specific part as we go through this prevention that I'm aiming at too, and that has to do, I'm a psychologist by training. I still practice in the Navy at Walter Reed National Military Medical Center at Bethesda, although in the Navy we still like to call it the Navy Medical Hospital. But it is, I worked as a psychologist in a PTSD TBI unit, but a lot of what I still deal with are people with severe mental illness. And severe mental illness is one of those areas that we really need to focus on when it comes to cancer. When we talk about primary, secondary, and tertiary prevention, in case you're not aware, primary prevention is what we tell everybody. Put your seatbelts on, don't smoke, eat right, plenty of sleep, right? Tell everybody that. Secondary prevention is when you say this is a higher risk group, then we need to focus special efforts on. And tertiary, of course, those who now have the symptoms, we want to work at symptom reduction or elimination. But I want to talk about a secondary prevention group, and that is people with serious mental illness. Those who have schizophrenia and bipolar and other serious mental illness have to remember that they have not only related to their disease, but they have a number of behavioral factors that directly contribute to cancer risk, including a high prevalence of smoking, obesity, physical inactivity, substance abuse, and infectious diseases, and stress, all of which increase risk for cancer. In particular, chronic hepatic infections such as hepatitis B and C, lung, pharyngeal, gallbladder, and cancer rates have been reported as much higher among patients with schizophrenia than the general population. And the list goes on in terms of the problems. And then, of course, you know, people with a chronic illness at least double their risk for depression. And when you have untreated depression and a chronic illness such as cancer, everything seems to worsen, and including healthcare costs at least double. So it makes sense as we're moving forward to identify this is one of the groups we need to recall. But in the area of mental illness, although we all alerted to it when there is some tragic shooting somewhere, we have to remember there's 60 million Americans in any given year have some diagnosable level of mental illness, from the very mild transient to the very severe. And there's about 11 million people with severe mental illness. And of those, this much higher incidence. And I believe if we worked on making sure we address their illnesses, mental illness, we could prevent a lot of their cancer to a massive level. So that's why I've introduced H.R. 2646, the Helping Families in Mental Health Crisis Act. By the way, I think we have 178 co-sponsors to date. Strongly bipartisan bill that Chairman Upton's working with us to move it through the full committee. It's moved through the Health Subcommittee. And as part of this is recognizing the high cancer risk, as well as cardiovascular disease, infection rates, et cetera. We know that a person with serious mental illness oftentimes doesn't take care of themselves. So if they are now identified as having cancer, very often, because of the nature of their illness, they may not want to even engage other family members. They may not want other family members to know their problems because their hallucinations and delusions affect them greatly. So if I have a patient who believes they're the Messiah, or believes that a mother or father is part of the FBI or the CIA planting electrodes in their brain and sending them voices, and a doctor says, you know, this John Doe is not following up on his care. It's early stages. We could really do something if we worked at it now But HIPAA laws say that doctor can't talk to the family and let them facilitate treatment. To me, this is one of the biggest crimes in what should have been a law to help people get better, actually serves as a barrier to make them get worse. We know that people with serious mental illness, when family members are involved, greatly improves their prognosis. But what we have to acknowledge, it's not just the prognosis of the psychiatric illness, it's physical illnesses such as cancer. Outside of suicide, which is high incidence of 41,000 suicide deaths in this country last year and 45,000 drug overdose deaths in this country last year, plus some homicides and et cetera, people with serious mental illness tend to die 10 to 25 years sooner. And much of that is because of cancer. We can prevent it if we get to folks early and treat their mental illness. We can prevent its worsening and work towards treatment and cure if we allow family members to be involved. One of the things I'm proposing is a tiny change in the HIPAA law that says when you have someone who is becoming gravely disabled, worsening in their medical condition, because they don't even understand or are aware of that, that a physician would have an opportunity to make a decision to say, at least tell the family member when the next appointment is, or what the diagnosis is, or what the medications they need. And current laws prohibit us from doing that. And I think it's such a cruel thing when you hear family members say, why didn't someone tell me? Why couldn't I do anything? And they had to watch a family member deteriorate. Let's remember them as we're dealing with cancer prevention, that there are some who just do not understand what they need to do, and yet there's something that we can do to help treat that and prevent. We'll be going through more discoveries, like with 21st Century Cures, it's going to fund and move us towards that. We'll be working towards more effective treatments. We want to continue that. But let's not forget those who have difficulty taking care of themselves, because we make it the most difficult for those who have the difficulty to take care of themselves. God bless you all. Let's fight cancer. Thanks.